Hi, this is Harry Margolis, host of Risking Old Age in America. In this podcast, Greg Olsen, director of New York State's Office of Aging, explains to me why New York developed a master plan for aging and how it seeks to achieve its goal of enhancing the livability of communities in New York for older adults. When I asked about how this would address the doubling in the need for elder care as baby boomers age, his answer was essentially to reduce that need by keeping seniors healthy longer and by making it easier for them to live in their communities with less assistance. Greg, thank you for joining me today.
Thanks so much for having me. Great to be here.
I'm wondering if you could start by introducing yourself and explain. Greg, thank you for joining me today.
Thanks so much for having me. Great to be here.
I'm wondering if you can start by introducing yourself and explaining or telling us about your journey to your current role as director of the New York State Office for Aging.
Sure, happy to. Thanks. Greg Olsen, director, New York State Office for Aging. So I've been the director for 16 years, been at the agency for 20. I oversee a network of 59 county offices for the aging. We work with about 1,240 community-based organizations, as well as other state agencies, associations, advocacy groups, et cetera. So I have a pretty big footprint in the community. My journey, I'm a geriatrically trained social worker. I've been working with older New Yorkers for 35 years in a variety of capacities. Ran a bunch of not-for-profit agencies for a little over a decade. Spent 4 years as the chief of staff and legislative director for Assemblyman Engelbright, who is chair of the Aging Committee. And then I came into state government in 2007 and been here ever since.
Okay. And you mentioned some of what the Office for Aging does in terms of all these agencies, but I wonder if you could tell us a little more about
Yep, absolutely. So our mothership, so to speak, that really created state units, or what's considered a state unit on aging. So there's one in every state. It's called the Older Americans Act, and it was passed in 1965 at the same time Medicare and Medicaid was. And reason being is we are the community-based, non-medical long-term care system. So we provide a variety of in-home and community services to help older adults stay healthy, put money back in their pockets, and stay as independent for as long as possible, preventing hospitalizations, emergency room visits, nursing home placements. But equally as important, if you wind up in one of those settings, in order to succeed, to go back into your community, you need the services that we provide. So what are those things? Transportation, for example. We oversee the largest nutrition program in the country, doing 22 million meals for 300,000 people every day. We have our own personal care program that's non-Medicaid, and those are things that help people with bathing and dressing and eating, shopping assistance, bill paying, et cetera, and so much more. Minor home modifications, benefit and entitlement assistance, comprehensive case management. So we're kind of like the best kept secret, right? We have about 100,000 nursing home beds licensed in New York, but we have over 5 million people over the age of 60. So the math just doesn't math. In order to be able to keep people at home, we need to invest in home and community-based services, which I'm very thankful Governor Hochul has really invested in us since she took office, invested $238 million in our agency to provide those services.
So any older person in New York can access those services?
Yeah, they're not means tested, but they're based on need. So there are some requirements for home delivered meals, for example, or our personal care program. But for the rest of them, what we always tell people is you don't have to remember any of the services that we provide. You have to remember one thing. Your first phone call is to our local offices for the aging. We have 59 of them, and we're structured different than other states, but other states have the same. They have a state unit on aging, and then they have what's called area agencies on aging. Ours are all county-based.
So you said it's a best kept secret. So why is it a secret?
Well, it's a secret because you don't need to know us until you need to know us, right? So fortunately, caring economy, we work in a crisis-driven system. And I've heard over the years, Harry, you guys don't do a very good job with outreach and education. And I say that's absolutely not true. People don't need us until they need us. And the two examples I always give, especially for New York, is you don't need to know about the Star property tax exemption until you own a home. You don't need to know about TAP and Pell until you're sending your kids to school. It's very similar to college. It's very similar for us.
So I'm quite interested in New York's master plan for aging. And so I guess why don't we start, if you could tell us why you developed a master plan for aging? first.
Yeah, and if you don't mind, if I provide some context, because I think
Sure.
when we often talk about older adults, we think of them as frail, as needy, as expensive, and as non-contributors. And I've spent the last 15 years really combating that false notion in ageism. So it's pretty easy for me to say what we do. We just did that. I can walk through how we do it, but we never talk about the why. So let's talk about the why. And I think the master plan is a culmination of 19 years of work that we started long before there was anything called age-friendly communities. And now the master plan, which is kind of age-friendly 2.0, we started in 2007 because we recognize that 80% of older adults consider themselves healthy, very healthy, active, and engaged. So part of what we're trying to do is help maintain that and improve that. But there is a swath of older adults, just like any population, that's going to need assistance. But let me just walk through some facts and figures that you'll never hear anybody but us talk about. Number one, older adults pay 40% of state and local taxes, $72 billion a year. Their spending supports 6 million jobs. They contribute 43% or $719 billion to the state GDP. We have 1 million volunteers holding up over 33,000 not-for-profits, providing 500 million hours of service at an economic value of $13.2 billion. Social Security pumps $70 billion into the economy. Pensions provide $41 billion to New York's economy. And a lot of older adults own their own homes, and many, many have no mortgage. Why that's important in New York is we're a home rule state. So those local tax dollars support Medicaid, support schools, support local businesses, and so on. So we start with the value of this population because you wouldn't have a local, regional, state, or national economy without them. And we need to start talking more about that. So what the MPA really is the governor charging all of the state agencies, because older adults touch many different agencies, whether that be veterans, mental health, substance abuse, transportation, adult protective services, tax and finance, parks and rec, transport. So you can't look at older adults just through the lens of the New York State Office for the Aging. We look at it holistically, and that's what the MPA is really designed. So number one, governor recognizes the value that I just talked about. Number two, governor recognizes the cross systems that older adults and their families touch every single year, and then really charged us with developing a process and recommendations by the people for the people. So what I mean by that is when we were charged with the Health Department and Department of State of starting this process a couple of years ago, it wasn't for us to write the recommendations. It wasn't for us to collect them, edit them, strike them. It was for us to really create a process that would allow us to gather information from the public, experts in aging, individuals personally. We did the first ever state needs assessment survey, which is really comprehensive. We have a state one and one for every county that really asks questions of people to self-report on how they feel about themselves and their community, all about livable communities. So that's really what we did. We had over 100 separate proposals, 20 public listening sessions, 430 stakeholders engaged, over 800 meetings. We had a council of state agencies, a stakeholder advisory group, 8 subcommittees and 34 work groups, 10 industry roundtables. So it was kind of like herding cats, but we have a lot of proposals. And I think what I'd like to leave listeners with, because as I travel all around the state, a lot of people that were engaged said, well, what's happening with the MPA? We don't hear anything. And that's our problem that we're trying to correct is that we don't articulate all the time that many of the things that agencies are already working on or working on now, or things that the governor have proposed in the budget are MPA recommendations. So you're going to see some language changes to really tie those things together so that the public recognizes, hey, we spent a couple of years on this process. It's not a report that sits on a shelf. We are actively implementing many of the things that are in the MPA.
So a couple questions. So in terms of the goals of the MPA, it sounds like it's really to make New York a better place to live for older residents.
That is absolutely correct. And as we started, I mentioned earlier, we started in 2007, and the MPA and age-friendly and livable communities and smart growth really benefit birth to death. And that's really the goal. Like if you're improving the lives of children, they're going to grow up healthier. If you can improve the lives of people in their middle age, they're going to grow into older age healthier. create an environment that helps older adults thrive, that it just benefits everybody. But that's exactly right.
So how much of it is aimed at improving care for I guess 20% of older adults who need assistance? And I ask that question recognizing that the number is going to double in the next couple decades with the aging of the baby boomer generation.
Yeah, I think the answer is twofold. So for the 15 to 20% of the population, it's about improving not only the formal long-term care system, and what I mean by that is Medicaid, nursing homes, home care, et cetera, et cetera. It's improving the non-medical, which is us. I mean, the number one recommendation endorsed by everybody was investments in the New York State Office for Aging so that we can get resources to the community level. But then there's general things that are really important for the other 80% plus the 20%, right? Prevention, wellness, promotion, and access, housing access and community development, affordability of basic needs, combating social isolation, combating financial fraud and scams. So you can't answer it with, again, one broad brush. I think it's a fantastic question. So there's things very specific to how do we make New York the best place to grow up and grow old? How do we continue independence and hopefully keep people off of Medicaid? How do we improve Medicaid and access? How do we improve access through our system, but also globally? There's many, many things in there that really address just basic needs and everyday living of all New Yorkers.
So it sounds like part of the idea is to change the ratio a bit between the 80 or so percent who don't need assistance and the 15 to 20% who do. If you can enhance the lives of the 80%, maybe that'll become 85 or 90%. And fewer people need assistance.
Yes, and I'm sorry to interrupt. Yeah, that's absolutely right. Or just to help people maintain themselves, right? So if you have a chronic condition, diabetes, et cetera, we run programs with others called diabetes self-management, where you can help manage these things that then lead to somebody maybe winding up in a hospital that didn't need to, winding up in rehab if you're trying to prevent falls. Falls cost a lot of money, but if you fall and break a hip, you're usually dead within 18 months. So there's these prevention strategies. And Harry, the way that the caring economy has evolved since 1965 is backwards. We spend 97% of our funding in the most expensive places, hospitals, hospital systems, nursing homes, et cetera, and about 3% to prevent those things and support people in their community. And so I think that there's not only a balance in terms of how can we reorient how the caring economy works, but also how do we identify and help people earlier on so that you can help them, again, maintain themselves. I think one of the things we deal with, again, and I talk about the caring economy broadly, is we really got to address a reality of our culture, right? Our culture is don't ask for help, pull yourself up by your bootstraps. Families and individuals go to great lengths to do that, and then they wind up touching us and other systems really when they're in crisis. And we want to try to reorient that it's okay to ask for help. When you do ask for help, good things happen. It's not a negative, it's a positive.
So I wonder whether some of that has to do with the fact that we don't have a single payer system. So we have a Medicare program that pays for acute health needs or medical needs, and it doesn't pay for all these social programs that would keep people out of the hospital. And that has to come from somewhere else.
Yeah, that is true generally. Medicare Advantage plans over the last couple of years have been social prescribing and providing additional benefits. But what we're seeing at the national level due to policy changes, due to HR1, is they're starting to roll these things back. But you're right. If you're out with a group of older adults and you ask them who pays for long-term care, or what does Medicare pay for, what does Medicaid pay for, the general person has no idea.
Yeah. So that's a kind of distinction, I think, between the U.S. and Europe, which has broader social programs and spends more on that and less on healthcare.
Yep, and their outcomes are way better, and they have been for decades.
Yeah. So your planning process for the master plan, how much did that cost?
It didn't cost anything. What we wound up receiving in the first year was $500,000, and that was really more a contract to develop the back room, right? The technology, the dashboard, the website, things like that. But the actual organization itself, we do that internally with our own staff, with our other state agency partners. So while there is a cost, it wasn't a financial cost, it was a human cost.
Okay. And in retrospect, is there anything you would have done differently?
I really don't think so, because we had the experience of becoming the first age-friendly state in 2018, and it was a similar type of process. It can't be the Office for Aging. It can't be the Department of Health. It can't be the Department of State. And so for people out there saying, well, what does the Department of State have to do with any of this, right? Really, really important, because one of the things that we are working on in New York, again, is community design. Suburbia was born in New York, in Nassau County, after World War II. Prior to that, people lived in cities and areas where they could congregate, where there was businesses that were walkable, and we changed that. And we developed suburban areas where housing is in one place, everything else is somewhere else, and you needed to get there, right?
You need to drive.
Yeah, and so the Department of State oversees all the county planning and zoning. They do training, education, et cetera. And in a home rule state like New York, the governor has a $25 billion 5-year housing plan, but you can't build housing in New York without the local municipality agreeing to it. So you show that things within the MPA we've already been doing is the governor has provided incentives to municipal governments to actually change their zoning laws, and many of them have. We're going into our 8th year of the Downtown Revitalization Initiative, which provides $10 million in grants that have livable community and smart growth features in them for communities to kind of retrofit. And if you drive around New York, you could see it. And what that means is just bringing together, it's called mixed use age integrated housing, bringing together housing, walkability, place for people to congregate, combat social isolation, but you could walk to a doctor, you could walk to a coffee shop, not heavily on transportation, which is a huge issue. 95% of New York's geography has no public transportation. Public transportation assumes you can physically use it, you know how to use it, and you can afford it. So it really fits in with New York State's prevention agenda. Again, preventing things, the health across all policies approach, which is really how all these different systems and organizations, state and local agencies that many of our families touch, how we work closer together. So we brought those groups together with Age Friendly in 2018. I think the governor tightened it up immensely. So that was the mistake we corrected from the 2018 process under the previous administration, was that the governor was very adamant. You got to pull in the right people. The tent is big enough for everybody, and that for adults and their families touch systems. We often highlight, Harry, all of the great changes in childcare that are in the budget, like the tripling of the child care tax credit, free school meals, free summer meals. Why would an aging organization do that? Because older adults are part of families, and we have almost 200,000 grandparents who are the primary caregivers of their grandkids. So that to them, it puts money back in the older adults who's a grandparent that may be working, may not be, back in their pockets. So we really look at, again, the governor's motto really fits in well with how we think about things. Your family, my fight. That's what the governor talks about. And older, really important part of families.
So it sounds like the message is that it's all integrated.
Well, it is. I mean, last I checked, my dad and my mom have sons. They have grandkids, right? They're part of our family.
Yeah. So I think I counted in the plan more than 100 different proposals or initiatives. And one thing I'm wondering, is that too many? I mean, how do you keep track of all that and make sure that things are actually happening?
Yeah, I think what you have to do. So no, is it too many? No, the whole purpose was, look, this is what we're trying to do. We want a short-term, medium-term, and long-term solutions that are achievable. And that's an important word, to make this the best place to grow up and grow old, to have older adults who are so valuable, maintain themselves in their homes and communities, continue to keep their contributions into the communities. We don't want people leaving New York and going elsewhere. We want to get, because we recognize that value. So is it too many? No. It's what people who live the life, who serve people, thought that we should consider. Now, not every proposal is feasible. So I kind of bucket them into 3 different areas, right? They're number one, what are agencies, what could they do or what are they doing that they can do administratively without law changes or reg changes? So I can give examples of that if you'd like. Then the second thing is there's things that are going to have a fiscal. They're going to cost money. Well, that's the governor and the legislature. And if they want to push certain proposals, one of them is investments in the workforce, especially in healthcare and long-term care. That was part of the budget. One was seeing Medicaid rates so that they could provide better care and staff up. That was in the budget, right? So these are things that are actually getting done. And then there's longer term things that might need a statutory or regulatory change that take a little bit longer. Not every recommendation is going to be something that's achievable, but many of them are. And I look at a lot of the proposals, and I can give you examples of things that were in there that either have been completed or are in the process of being completed, and many more, like I said, within the budget that was just passed last week.
Well, why don't you give us a couple examples?
Sure. Like I said, the number one was actually proposal number 50, which is invest in the New York State Office for Aging. So an additional $68 million was provided last year and sustained this year, which is really important. Supporting caregivers, both working and non-working. What's a caregiver? Anybody like you and me that are providing uncompensated care to somebody else. We have a vast array of caregiver support services. We partnered with the Department of Labor to provide resources and supports to working caregivers, recommending food as medicine promotion. Well, we've been doing that for about 5 years in consultation with the Department of Agriculture and Markets and other public and private sector agencies, because food is medicine. And as I mentioned, we're the number one nutrition program in the country. The governor invested heavily this year in the emergency food network with not only resources, but infrastructure. Create an office of older workers. We did that with the department. So there's a new Department of Labor specifically for older workers that we partner with them on, which really targets the 60 one-stops. So Department of Labor has training, education, resume building, connection with local businesses all throughout New York State. Older adults are part of that. Strengthening access to hospice and palliative care out of 50. We're the worst in the nation in access to hospice and palliative care. Department of Health created a bureau to really focus in on that. Create an Office of Benefits Coordination. That was in the State of the State this year that charged me and my agency with providing the governor's office and the Office of Technology Services with a recommendation on creating a one-stop for benefits for all older adults. Because again,
that's really important.
They're spread out in all of these different agencies.
Right.
And don't know what there is available to them or how to access them. So one stop. It was a big focus, and I was really pleased that the governor included this in the State of the State. We do a lot of work on financial fraud and scams. Scams cost Americans $119 billion a year, and many of those are targeted to older adults. So the governor charged me and the agency with developing a real enhanced education, training, and outreach. We are 80% through that. And that was just announced in January. We're almost done. So we're partnering with some of our community partners who are experts in this, partnering with the Division of Community Justice Services, who does training for law enforcement, cadets, and others on how to identify and how you gather information so you can prosecute. We're working with the Department of State, who is the lead agency in identity theft and deed fraud. So we have a lot of those types of things happening. There was a recommendation to expand what we call the naturally occurring retirement communities. And we have over in New York.
NORCs.
Yeah, the NORCs and the neighborhood NORCs. So we're going to be growing. We're going to be doing 20 more NORCs statewide, 7 in rural areas, 7 in suburban areas, 6 in urban areas, additional $8 million in the budget. And what that does is it brings social services and clinical services, healthcare monitoring together. It's a real integrated care model that's way ahead of its time. That's just a snapshot.
Sounds great. So what recommendations would you give to other states who are considering doing master plans for aging?
Well, I think the key thing in being in state government so long is when a governor wants to pursue a plan like this, the lead needs to come from the governor's office, like it did in New York. A lot of times, and I'm not going to say this in New York State because it's changed since I've been here. I've worked for 4 administrations, and this administration and the partnerships among the agencies and the friendships you have with the other commissioners is different than any other administration I've been a part of. Prior to a lot of the agencies worked as their own little fiefdoms, right?
Right.
So if a a governor charged a particular agency with doing something and then left it to them, sometimes you get agencies that won't participate or they don't recognize why it matters to them, and they may participate, but not intently. You need that direction that says, this is really important to us collectively and working on it together. That's why I think in a lot of other states, if it's not coming from the governor, maybe a bill was passed by the legislature, they're not going to have the same results because you need that real tight coordination coming from the top, directing us to work together, which wasn't hard here because of what I had just said. But that's key. And you got to have a plan. And you got to have a plan that makes sense. It sounds complicated, but it's really not complicated. First, what is it that the agencies already do to support older New Yorkers and their families, or pick another state? There you go, right? Because if you went out and said to somebody, hey, what does this community need? And somebody says housing. Well, of course you need housing. But if we say, here's the 11 things that we're already doing on housing, then the answer you're going to get back is different because it's well-informed. So that's really important to set that baseline. Then the second question is, what are you working on now that supports older adults and their families? Because not everything people are working on are in the budget. For 3, then you start the public organization process. But you have to start with a baseline so you can let the public know. State agencies don't know what state agencies do, generally. County agencies don't really know what the state and counties do, generally. And therefore, how could the public? So you got to start with a baseline.
Okay. Well, that sounds great. And I hope more states do this, because it's certainly a growing need, and it's going to be growing.
Well, and I think that's one of the great things when you look at our elected representatives. Senator Gillibrand has been a stalwart. So she's introduced legislation with funding to provide money for the states to really go through this process. So if they wind up in the majority in the fall, we'll see what happens.
I hope so. So I always end my conversations with the same 2 questions. One might not be as appropriate for you, which is, if you're going to make one recommendation to policymakers, what would it be? But I guess, why don't we switch it from the state to the federal level? So if you're going to make one recommendation to policymakers in Congress, what would that be?
Stop reducing supports for low-income families, whether that be Medicaid. How do you take $1 trillion over 10 years out of Medicaid, which funds healthcare, long-term care, hospitals, staff, transportation, doctors, dentists? The caring economy is going to shrink. We cut SNAP benefits that put food on the table. We just talked about food as medicine. The primary beneficiaries are not immigrants, illegal immigrants, because they're not allowed to have it. It's children, number one. It's low-income families, and it's older adults. We didn't have the home energy assistance program for 6 weeks. And so who filled in the gap to help people pay for their heat? We did. We used our own dollars that the governor invested in our agency to do that. We're running right now on a continuing resolution from last year. So for us, thankfully, our funding is level going into September. But we saw what HHS, Health and Human Services, proposed, and there were 4 pages of really important programs that they proposed to eliminate, like adult protective services nationwide, like the long-term care ombudsman program, which we oversee, that sends highly trained staff and volunteers into nursing homes to assure quality of care. So what winds up happening, Harry, is when you start to reduce funding at the federal level, then it's up to the state and it's up to the localities, and it has an impact on not-for-profits because we fund all of those down the chain to have to pick up the slack, and it's very difficult to do in this environment. And with the state of the economy, it's going to become, and it is becoming, a lot more difficult for people to afford gas. So that means our volunteers are going down, to afford food, to afford their health care. And then they wind up turning to us, which is why our demand for services is increasing.
So did those cuts actually happen for protective services and the others?
They were proposed, but they did not. They did a continuing resolution. So right now we're good, but who knows what's going to happen over the summer, because the start of the federal fiscal year is October 1, 2026. And if you propose it once, do you propose it twice? I don't know. We'll be keeping an eye on it, but I just gave you a snapshot. I mean, they propose to eliminate every financial incentive to get people, doctors and others, into health and long-term care. There's only one geriatric program, like incentives for physicians and others to get into geriatrics, only one nationwide. They propose to eliminate that. We hardly have any geriatricians anywhere in the country. And you can't have a generalist physician serving older adults because it's a specialist. But we've had that for decades.
Yeah, I just heard about a study, I think in Minnesota, that shows that patients who go to geriatricians live longer, and I forget how much longer, than those who go to general practitioners.
Right.
So my last question is, if you're going to make one recommendation to baby boomers or family members of baby boomers who are concerned about future care needs, what would that be?
For them personally, you have to start to plan. Planning is critically important. I know people are afraid to get older. You'll spend more time researching a microwave than you will about what's available. So again, who pays for what? Estate planning is really important. And many people in their baby boomers, people like me, who may be a little older, might be caring for somebody else. We have 4.1 million caregivers in the state of New York that are providing uncompensated care. Out-of-pocket costs, they spend $7,000 to $10,000 a year, but they're also providing a lot of tasks: transportation to doctor's appointment, personal care, paying bills, shopping, preparing meals, etc. That we're out there and get to know what is out there, right? Our system is often accessed in crisis situation. So lay of the land, understand who pays for what. We can provide services at 1/17 the cost of Medicaid and keeping loved ones at home. So I think there's a twofold answer to that. Take care of yourself. Alzheimer's disease is not a normal process of aging. You can significantly reduce your risk of getting dementia pretty simply. Eat well, exercise, get your hearing checked, stay aged, volunteers, and then really good, try to get as best sleep as you can. Those things, again, sound pretty simple. They are, can reduce your risk of dementia by 250%.
Sounds good. I think I'll follow that advice. Thank you very much, Greg.
Thank you so much for having me. I really appreciate you covering this topic.
Thank you for listening to my discussions with experts about the challenges facing the United States as our population ages, along with possible solutions. You can visit my blog on these topics at okboomer.substack.com. And if you have questions, comments, or suggestions for other topics or speakers, please email me at harry@margolis.com.